cardiologists like myself are sending babies home and would just say, just check your baby's oxygen level 3 times a day, weigh them, do the things we asked you to do, and then enter it into an app, which is a lot of a burden. And also, we know that 3 times a day is not going to capture everything. The value here is that you have a device that has the capability of safely monitoring for a continuous period of time and potentially have the opportunity to have an early detection system for unusual dips or trends.
Welcome to Bostic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change.
I'm super intrigued to dive in here with Dr. Alisa Niksch, who is from the Boston, Mass area, but is with this really cool company called Owlet that is doing some of this very important work related to keeping babies healthy. So thank you so much for being here.
Thank you so much. It's great to be here today.
So you still practice as a physician, or have you completely shifted?
Okay. I still do a little part-time work, mainly in the pediatric cardiology, doing consultations on the weekends and evenings.
Okay, that's amazing.
This is
keeps you close to patient care.
Owlet is my full-time work now.
Okay, awesome. Well, how did you find your way into this entrepreneurial change the game for babies as patients monitoring?
Yeah, so I'm a pediatric cardiologist and object physiologist. By nature, that professional track really puts you on the forefront of remote patient monitoring. We've always been monitoring patients with implantable devices that I would put in babies and children, as well as my adults electrophysiology colleagues. And that really sort of inspired me to really sort of see what the future was when it came to some of the non-invasive tools that we use, wearable tools. And at some point when I moved to Boston in 2010, got really, really interested in sort of that movement and sort of the entrepreneurial community, the startup community, early stage, and started to actually consult, mentor at organizations like Math Challenge.
Okay.
And finally found my way, into kind of more full-time work in industry.
Okay. And then your title is Senior Director of Medical Affairs.
Yes.
It sounds like a title that allows for you to be pointed at a lot of different things. Is that fair?
That's fair.
Okay.
Yeah. I sit in the middle of, I think, several teams, both devoted to clinical research and executing those projects, into healthcare commercialization, especially for our prescription device called BabySat, and also in still that product development and regulatory space where I'm still contributing sort of my clinical experience and sort of the voice of the physician and the patient.
Mm-hmm. So you got this very cute little sock here on the table.
Yes.
And I'd love to have you tell us about, what is the situation where one of these is useful? What was the state of healthcare before you came up with, this device became real? And what's the effect that it's having on the infants?
Well, I think that, first of all, and it's still the case that I think pediatric-centered device development is really lacking in the industry at large. And I think that certainly the company was founded on very personal and very family-oriented motivations. And I think that everybody who works there is a very mission-driven person.
So was the origin story that the founder had a child that needed the monitoring, or what was the backstory?
There was definitely an inspiration on, infant loss and tragedy. And that's, kind of where this came in terms of, we need something that fits in the home environment, in nursery. We don't want a big box with wires.
Yeah. Well, and babies don't want things on their arms, or their head, or, so the foot is a logical place, right?
This is obviously, it's progressed over the years, but now is a very, obviously
lightweight,
very safe. The fabrics are well designed. Obviously with our FDA clearances, went for a lot of the biocompatibility and form, fit, and function that we had to prove really works for even continuous monitoring with this type of device.
So it's completely FDA approved at this point.
Yes.
And what is the scenario where this is a device that gets used? What's going on with the
We
baby?
have two products. This one I'm holding is Dream Sock. This is our over-the-counter product. This went through a de novo clearance with the FDA from in November of 2023. This is intended for infants right now between the ages of 1 month and 18 months that are healthy with no baseline medical conditions.
Okay.
This is really to detect any unanticipated illness or event that might happen in the home. We also do some sleep tracking with
Okay.
this device, so that appears in the app that's associated with the product. The other device we have, which is also indicated for right now 1 to 18 months, is our prescription product called BabySat.
Okay.
And BabySat is really a prescription pulse oximeter, a wearable at home, same form factor, but for infants that need chronic medical management at home, such as babies with significant congenital heart disease, arrhythmia management, as well as infants who are premature who go home on oxygen because they have chronic lung disease of prematurity.
Okay, interesting. So the device that you're holding is really for anybody who has a baby and wants, it's sort of like a biometric monitor, like I wear a Whoop band, so it can tell me that I don't sleep well when I have some alcohol, you know, but the babies aren't having alcohol. So, but this is monitoring their biometrics through their little foot.
Yeah, and of course we have an associated camera. We call it Dream Sight. This is something that is associated with the Dream Sock. It could be integrated into the app, the visuals, so you can correlate the vital signs that you see in the app with sort of what's going on in the nursery, what's going on with your baby while they're sleeping, while they're in the crib. Do they look uncomfortable? Do they look like
Oh,
they need you to come in and help settle them
interesting.
down?
Interesting. Wow. That's crazy. I don't know why I'm doing this, but I'm trying to relate it to things that I do. And I have this thing called 8 Sleep. Have you heard of this? It's like the number 8 and then the word sleep.
Okay,
And it's
yeah.
a biometric, it's like a high-tech mattress pad
Okay.
that monitors you, and it adjusts the bed based on things that you're doing. And basically it tries to help optimize your sleep. And it gives you a report in the morning that says, we made these 17 adjustments
That's
in
right.
terms of the temperature and the angle and everything. And therefore you had this much more REM sleep and you had this much more, deep sleep or whatever. Is this kind of stuff happening with, it's called Green Sock? Is that what you said?
Dream Sock.
Dream Sock,
Yeah.
Dream Sock. Because it is kind of green. So
It
I
is
agree.
both green.
Okay.
It is a
Dream
green.
is the
Yes.
Dream
This
Sock.
is our
Okay.
signature mint green.
Okay. Got it.
So in a way we do. And we already perform a lot of sleep analytics and some predictive sleep. We partnered with an AI company to come in and look at sort of what we can put together, both with our physiologic data as well as the visual data from our camera to look at sleep habits, sleep developments, any sort of sleep disruptions related to maybe feeding.
So what you're saying is you're going to generate, you're creating a pathway to create the next superhuman who's like perfectly optimized for, because like sleep is the most powerful medicine, right?
It's so powerful.
Yeah.
We
So
agree.
so the Dream Sock, like how much adoption are you seeing, and then how does that get marketed to new parents?
Owlet itself has monitored over 2 million babies products over the years.
Okay.
Dream Sock, since it's gone to market, we now have approximately 400,000 babies who are wearing Dream Sock month over month.
Okay.
So it's approximately 10% of the yearly birth rate.
Congratulations. That is major. That's fast.
Yeah, it's fast.
Well, people will do anything for their babies.
I
And
agree.
why wait until you're way down the path to use biometrics? Why not start as a baby? So switching gears to more of the clinical application of the baby
BabySat.
sat,
Sat.
like
As in
SAT?
saturation.
Okay, okay, baby sat. So with the baby sat, this is where you've got a sick baby who has some issues that need to be actively monitored. And before the baby sat, would they have to spend more time in the hospital, or what was happening before?
So yeah, so certainly it depending on the population, uh definitely, especially the neonatal premature infant population, many of those babies would have to spend longer time in the hospital because of the lack of monitoring
Yeah.
capabilities.
Right.
Or let's say they could get a pulse oximeter, but the insurance company was fighting them over it. That's something that definitely would hamper and increase the cost of care and increase the burden of care on those babies. For the babies, for instance, that have only one functioning ventricle,
Okay.
um, those babies would typically go home on a traditional pulse oximeter, which was comprised of a big box on a shelf with a screen that showed you the numbers.
Okay.
There were wires that connected to the babies, whatever they were
Right,
probe
yeah.
they were using.
Kind of like you see in a hospital.
That's
Yeah.
right. And the probe would be adhesive usually. So
Right.
it would be an adhesive against the baby's skin.
Right.
And the devices
And they
that
come detached when the baby moved too much.
and
Yeah.
these devices are meant for more of a clinical setting. So they are not programmed to they're programmed to actually maximize sensitivity.
Mhm.
So anytime the baby would move or flinch, even 3-second dip in oxygen.
Right.
So we have a situation where cardiologists like myself are sending babies home and would just say, just check your baby's oxygen level 3 times a day, weigh them, do the things we asked you to do, and then enter it into an app and then send it to through to our portal, which is a lot of a burden. Also, we know that 3 times a day is not going to capture everything. But the value here is that you have a device that has the capability of safely monitoring for a continuous period of time and potentially have the opportunity to have an early detection system for unusual dips or trends that can, lead to an immediate intervention.
Yeah, yeah. So you can be proactive and predictive versus waiting and then something goes bad and now you're in this very fragile situation. I'm sure that helps a lot of parents sleep better as well themselves, because that's a tough thing, like the mental health toll on a parent who has a child who has, an issue like this that relates to cardiac in particular. That's fascinating. Well, I am really happy that we had a chance to feature you on the podcast. And I would love to know also at ViVE, what is the focus for you here? What brings you all to ViVE?
So our partners with middleware and our EHR integration program,
Okay.
Rhapsody, we are giving a talk tomorrow
perfect.
over at the Innovation Theater A at 1:25 p.m. And we're going to be talking about pediatric data, rich data sets, and the potential of interoperability and integration to promote better capabilities of predictive analytics and AI in addressing what I think is an underserved area, which is
No doubt.
pediatric health.
No doubt. We have a portfolio of health tech companies, and one of them within my fund, Health Cloud Capital, one of them provides an anemia-focused program that relates to predicting and identifying those people. And as it turns out, when expectant mothers are anemic, it results in a lot of really bad potential outcomes. And that's another example of something where you just assume that's being taken care of, and it hasn't been as much. And it's so cool to see the positive impact on the mothers and the babies. And I was not aware of Owlet before this meeting. I think it's really interesting, and certainly we'll tell our folks about it that are dealing with these, maternity situations and dealing with OBs that are looking for the best possible care for their babies. And I'm sure the word is out in the OB community at this point.
Certainly, I think that I think the main power is our consumer base. Their word of mouth, their social media presence.
Yeah.
I think where we are kind of pounding the pavement, so to speak, is with the medical community, and to let them know that these devices are FDA-cleared. They're safe for the babies. They don't over alarm in that moment, which are all concerns. And of course, for our prescription device, they're covered by insurance.
Oh, sure, yeah. Well, maybe you should create a baby social network, and they can all be connected to that too. And then they can really get the word out. They got nothing else to do. Yeah. Just kidding. Sorry, they're really bad attempt at humor. So, well, really cool meeting you, Dr. Alisa Niksch. Really amazing work that you guys are doing. I'm so happy that you brought the actual device as well to show it. to our audience. Super cool. And everybody, now that anybody I know who has a baby, I'm going to definitely need to get them one of those little
Thank you very
socks.
much.
And you know what, that you couldn't provide a better gift than that.
Well, that's great. Thank you for having me here.
Awesome. Yeah, and good luck with the talk tomorrow. We'll definitely have to check that out.
All right.
Awesome. Well, thanks everybody for being here for another episode of Bostic Health in the Wild at ViVE.